Hey, Sarah, so talk to us. What's one piece of advice you can give us this Monday morning?
All right. So my piece of advice is to be aware that the work that your team is doing when you're not around probably isn't as good as you think it is. That's a little controversial to hear. It's not what everyone wants to hear. So, first, let me clarify a few things. First, by not around, I don't mean you're on vacation. I mean that you're just not present. So it means you're busy, you're distracted, you're not paying attention. That's what I mean by when you're not around. And I also wanted to clarify that this is not anti-team by any means. We are super pro team. We love teams. It's just that there is a disconnect between what the leader should be doing and should be providing and what the team is actually receiving. So I've been a team member myself. I was a dental assistant. I worked at the front desk. So again, we're super pro team. This is more of a leadership concept here.
Okay, gotcha. So is it more in the sense of like, hey, we're doing what we're supposed to be doing clinical work, right? Talking to the patients, being with the patients, but then we don't really know what the front office is doing. They're doing busy work, but not productive work.
That's a great way to put it. Yeah. The truth is that your team is almost certainly underperforming in some key areas if you're not engaged in managing. So as coaches, we get to see and hear this a lot. Owners don't always want to hear this news, but we get to look at the metrics and we get to listen to the phone calls. And when we look at these data points, we can see that the team is not performing the way that the practice owner had been hoping or the way that they have always believed that their team is performing.
So why does this happen? Is it from the beginning, from the get-go? Is it happening like that? Or is it more like they fall into a lull and now they're not performing as good, but they figured a way to make it look like you are?
We actually have a top 10 list of all of these key areas, the ways that teams typically underperform and the ways to address it. And we're going to have that on our Facebook page. It'll also be on our website under the resource library. So we probably wouldn't get through all 10 of those today. And like you said, some of them do apply early on. Some of them can apply to long-term team members that have maybe started out super energetic and fired up, and things have drifted off into a different place at this point. So basically, as leaders, we're failing our teams if we don't provide guidance, AKA training and systems, clarify expectations, monitor the results, and hold the team accountable. So as we like to say, inspect what you expect.
Okay. So then what would you say are the most common that you've seen time and time again?
The primary one that I would say is on the phones. So we're seeing really common things happening on the phones that owners are totally unaware of. They're trusting and hoping that their teams are doing a great job. In fact, sometimes they genuinely believe that their team is doing a great job. And it can be really frustrating and disappointing for them when they find out that that's not the case. So I would say phones and what's happening on the telephones is one of the biggest areas. And luckily for us as coaches, one of the areas that we're able to document and observe the most closely is the way, especially incoming new patient phone calls, are handled.
So then when you're listening into these phone calls, where do you see them drop the ball the most?
Yeah. So the most common theme is just reactively answering. The first question, of course, is usually, do you take my insurance or how much does this cost? And so they just go directly into the nuts and bolts of answering that question without building any connection, building trust, without building value for their practice and talking about the doctor and the practice and why you're going to love it here. They go right into the nuts and bolts of a complicated insurance plan, something like that. So not taking control of that phone call right from the beginning is where we see team members fall off the tracks most often for this. And again, this is a leadership issue because the team members don't have the training, the systems in place to have those successful conversations with new patient callers to get them into the schedule. So it's not a team problem, it's a doctor problem.
Providing the guidance. Could you, Sarah, give us like a script to that reaction? So like, let's just say it's super common, right? Where it's, hey, do you take my insurance?
Usually people, it's a lot of no's. It's a lot of going down rabbit holes and, oh, we don't place implants here. You'd have to go see a surgeon. It's a lot of roadblocks and a lot of denial. So I think a lot of team members are afraid to give unrealistic expectations. So they shut things down right away. And consequently, the patients are like, oh, okay, I guess I'm not coming in. It's so sad. And we just hear hundreds and hundreds of these calls all the time where it's like a dead end. It's a roadblock. It's a bottleneck in the conversation. So instead, we have to take that tough question. Sometimes I like to envision it as a brick or something that if somebody's handing you this object, you have to take it. It's not what we're going to deal with immediately. We're just going to set it right here. And then we're going to draw the patient in by connecting and by building value for the practice before we get to that tough, thorny question that we're going to deal with soon. So it could just be something like, first up, you answer, hi, my name, practice name, how can I help you today? And then they're going to give the tough question. They're going to hand you the brick and you're going to say, awesome, that's such a great question. I'm so happy to help you with that today. Let me just get a little bit more information so I can help you out with that. And then you just go right into get their name, use their name through the rest of the call. And then you're going to find out why they're really calling. So patients are asking about insurance and pricing because they don't know what else to ask. But what they really want to know is, are you guys nice? Are you guys good? So you got to build that connection. You got to build the value. So you're going to say, oh, you just moved here? That's awesome. Welcome to the area. You're going to absolutely love it. And you're going to love our office. Dr. Jones is amazing with whatever it is that you wanted. So if you asked about a crown, he's awesome at crowns. You're already building that value and that connection. And team members invariably think that's a waste of time. We don't take their insurance. Let's just end the call. But you're going to lose 100% of those callers. If you're at least build a connection and you're building trust, you're building value, so much more likely that you're going to schedule that patient and that patient's going to actually show up.
I like that. I like the way you put it, like as a brick. I remember there was a thing where they said, like, in different cultures, more like Japan, when you bring a gift to them, it's considered rude to open it in front and be like, oh my God, compared to here, like in America, right?
That's good.
Here we want to open it immediately and we expect it. But over there they say, like, put it to the side and acknowledge the person. Don't worry about the gift for now.
That's great. Think of it as a gift that someone just handed you, because the gift is they're presenting themselves to you as a potential new patient. This is not some terrible problem that someone just handed you. It's a potential new patient, and it should be the most exciting and important thing in your entire day. But sadly, team members don't get the training on this. They don't know how to take that call and take control of it and turn it toward the things that really matter. Of course, we're going to answer that tough question. We're not going to be evasive. We're not going to be dodging questions. We're going to deal with it, but we have to build that connection first.
I like that. And then real quick, for the back office, where do you see it where it's like, hey, you guys are being busy, but not productive?
Yeah. A couple different areas where your team is probably not optimizing and they're underperforming in certain areas in the back. One area that we've seen recently a lot is supplies. If the team member is ordering supplies, they probably don't have designated time set aside for themselves to do that. They're just fitting it in wherever they possibly can around a busy schedule. They probably don't have a system. So they're just ordering whatever's easiest with no way to price shop and look for the best possible options. We had a client recently whose supply costs were almost 20% of their revenue. Their minds were blown when we shared this data with them because they hadn't looked at it. With just 3 simple changes, we're setting aside time for the clinical assistant to actually do this task, training her on how to do it and what system they were going to use, and then setting a budget and setting some really clear expectations. They cut their costs dramatically without sacrificing one bit of quality. And in fact, it's actually much easier for everyone on the team now. That's just an example of where if you're not paying attention, if you're under managing and not inspecting what you expect, you're going to get a result that is really out of line with what you're hoping. And you're going to see it in the numbers.
I love that. Inspecting what you expect. Awesome, Sarah. I appreciate your time. And if anyone has further questions, where can they reach out to you directly?
Yeah, absolutely. So you can email me directly. It's sarah@indiepractices.com. That's INDIE practices.com. Or you can check out our website or just chat with me on Facebook. So just reach out to Sarah Blair on Facebook and message us on Indie Practices on Facebook. We're always putting out new content and you can check out what's going on.
So that's going to be in the show notes below. And Sarah, thank you for being with me on this Monday morning episode.
It was a pleasure. Thanks so much, Michael.